Video and a profile pic.
5 degrees.
Okay, it's 3 o'clock and it looks like we have more than enough for quorum. So I'd like to call us to order for February 2nd Remac meeting. Can I get a motion to approve the minutes from December? Sorry.
I'll give you a motion, but there's one correction. It says we have to be weary of the Omicron variant. I believe worry was the expected term, but it was not incorrect, so we can leave it. But I believe that the thought process was worry.
I would suggest we leave the option in there, Bruce.
To be weary.
I suggest we do a / weary or wary. Choose your own adventure. Okay.
I'll second it.
Okay, we'll make that change. Okay, correspondence. Fortunately, we're a lot shorter this month than last month. There's one disciplinary action for Andrew Sequitz of Cicero, New York. Certification suspended for 1 year, effective 12/17/21. It is stayed pending completion of a 3-year probationary period. This is due to violations of Part 800.3 and Part 800.3 AS and Part 800.15. Okay. Committee reports. Don for academic operations.
Okay, so a bunch of things to be talking about. First, Art brought up the fact that Albany Med's only getting about 20%, or excuse me, or missing 20% of charts of EMS providers that are coming to them. I don't know what St. Peter's loss is. I don't know if Dean has any idea of what we're not getting. Peter Brody believes it was due to the fact that people weren't doing charts. That seems like a large number of percentage of charts that aren't being done. I'm sure there'll be a few there. So it's something we're going to have to bring up, I guess, at the next CMAC SEMSCO meeting, if this has really become a problem where they're just not getting the charts. Let's see. There, I guess I'll bring it up at this. It really ties into CMAC and SEMSCO, but I don't know if anyone's had a chance to take a look at the New York State executive budget for health and mental hygiene, Article 7 legislation, specifically Section F, which applies to us. It's about 230 pages or so, so you get pretty bored reading the rest of it. But it does have a number of changes to public health law that affect EMS. There are some good parts and not so good parts. The good part is basically it now is making the counties responsible to provide EMS statewide. However they do that, it doesn't specifically say. In our area, obviously there's not a problem. In some other areas like Otsego or Schoharie County, that clearly is an issue. But it brings us one step closer to making EMS an essential service. Other good parts, it appears that EMS personnel will be able to work in the hospital, doing whatever they do in the field, which would be great. Will give us more help for sure. One of the bad aspects, there is a specific area there that talks about health department doing QI with potential enforcement, which would not necessarily be very good. Had a long discussion with Ryan Greenberg from the health department and Mark Philippi from SEMSCO when we went over this document, saying that something that at least I could not agree with, or that it may not make a change, but there certainly is an issue with the health department doing QI and then having enforcement, which could be fines. Greenberg basically said that that wasn't their intention. It was just to provide QI, but that's not exactly how it's written. So hopefully that will get clarified a little bit better for us. So we will know what that means. Let's see, moving on from there. There's also reportedly money that's going to be available. The rumor is somewhere around $5 million to go to EMS. It's not quite clear where exactly that's going to go, but hopefully there'll be more specifics on that in the future. Let's see, Mike brought up the fact that we have a significant deficit with 1 to 10,000 epinephrine preloaded syringes. And a lot of agencies now are mixing up the 1 milligram 1 to 1,000 with flushes, if the flushes still are available. Has become a little bit of a problem at St. Peter's as well. Diversions, that was talked about as well. And at least trying to get a system set up so that we'll all know what diversions are out there. Do you want me to go on with CMAC and SEMSCO while we're here, or?
It's all kind of part of it, sure.
Yeah, sure. Okay. So the CMAC and SEMSCO meeting currently is scheduled for April. I won't know until tomorrow, but there tentatively is a change to May 3rd and 4th. As the health department is quite busy with everything that's going on with the Omicron variant. If that change occurs, it will not be down in Albany. It will actually be back at Troy at the hotel that we had been in the past, which will be a little more convenient for folks who are staying over. It also is not quite clear if it's going to be in person or if it's going to be hybrid or it's going to be virtual. I suspect it will be hybrid, but I don't know that for a fact. That's
Could you just say what the change was again for me, please?
the change in dates.
Yeah,
At this point, if it changes, it will be May 3rd and 4th. But I will not know that for a fact until tomorrow. As soon as I find out, I'll let everybody know.
and that will be in Troy?
Yeah, if it's changed, it'll be in Troy.
Okay,
Otherwise, if they keep the original dates, which was in April, it will be in Albany down the plaza. There were a number of courses.
Erica,
How are you today?
good, how are you?
Good.
Busy?
Can we take a phone, huh?
Katona, it's a trip and a half. Nice day
Mary,
for
can
it.
you go on mute?
Made up my mind.
Whoever G is, you may want to mute.
That's okay.
Uh-oh, sorry.
There's also a number of courses. Skidmore College has an EMT course. Remo has a SUNY course in Homeland Security, which is full. Remo has a free DOH EMT that also starts. It's full. Saratoga has a course starting on 2/7. Hudson Valley and Cobleskill both have courses, but they started in January. And they also, we talked a little bit about a site to document online. It's an online database to report if you're struck by a vehicle or near struck by a vehicle while you're out doing EMS in the field. That's basically it.
Okay, thanks. Remsco, aside from the trading announcements that you already did, discussion was about the Remo Arams Mountain Lakes merger consolidation. They do have legal involved with drafting up how to approach this. It looks like Arams is the more important because their executive director is looking to retire. After that, just some membership discussions. There was resignation and renominating as Jim Stairs, Brent and PJ Keeler for their own positions again for next year. That's it for Remsco. And then QI, looks like there's no meeting until February. Hawk, Tim.
Yep. Hawk met January 12th and surprised discussion focused basically on region COVID ops and hospital staffing issues. At that time, the Hawk rep, Scott Heller, only med Hawk rep, advised that as of that date, AMC was not accepting any COVID transfers. It's probably changed since then, but that basically was the focus of the meeting, COVID.
As almost every other meeting for the last 2 years. Okay. Agency updates, fortunately none except for EPCR's Center Brunswick Fire Department. Public access, only a few this month. GE Power Systems, Brookfield Renewables, Shenandoah Center City School District, and Momentum Performance Materials. All of them are updates. New business, we'll go a little out of order with this. Saratoga Hospital is coming to this with their intention to open up as a stroke center, a primary stroke center. So with that, I'd like to introduce Tasha Briggs.
Hi, guys. Are you able to hear me okay?
Yep.
All right. So Dr. Donna Marama was going to try to be on the meeting today, but he's working clinically from 7 to 4. So he asked if I would step in just to talk about where we're at with the stroke program and what's going on. So I'll just do a quick run through, and then if anybody has any questions, you guys are probably pretty familiar with the primary stroke centers, but I'm here if there's ever any questions that come up, you can call me. So Saratoga Hospital applied for primary stroke certification through the Joint Commission. We're expecting our Joint Commission disease-specific survey in March. We've been submitting data to the AHA since 2020 last year, and for the 2020 year, we received a Silver Plus award. The 2021 data is still in progress. For the agencies that might come to us as part of the data abstraction, the PCR for stroke patients are reviewed. And I'm specifically looking for a documentation of pre-hospital notification, the last known well is communicated, and the stroke scale findings. And Saratoga is using the BFAST for the stroke assessment. And then what you can expect back from us if you bring somebody to us is that I'll usually get a stroke feedback form to you within 72 hours for anybody that receives TPA. If it's a stroke case or a subacute stroke case that you bring in, I review them monthly and wait for the final principal diagnosis to come back as stroke. And then you might get a feedback on those patients, but not necessarily every patient that will get called in as a stroke alert, because I don't have any notification when you guys actually call it in as a stroke alert. Part of applying for stroke certification is we have to offer, not that we have to offer, but we're always willing to do education, but it's also part of the certification process is to provide education to EMS. So if there's anything that we can do for you guys, if you have any ideas, I know last year I attended a couple events, not last year, I guess it's over 2 years ago now since COVID, couple events and did some education on STEMI. We could do something similar with stroke. And we also have some possibility to share some modules that we bought. As far as stroke education goes, there is an EMS module. So if anybody's interested, let me know. As far as the neurology provider, there's been a lot of questions about that. So for inpatient acute stroke alerts and inpatient rounding, we're using a teleneurology program partnership with telespecialists. They're an award-winning neurology provider. We have carts that are meant for interactive. It's the audio and visual with the nurses trained in NIH stroke scale and such to help the teleneurologist do the assessment. And then we also have a Saratoga Hospital Medical Group neurology practice now for our outpatient setting. Dr. Donna Rama's message she wanted me to send was that we welcome EMS agencies to bring the acute stroke patients to Saratoga starting immediately. What we've seen some of the agencies doing is just call first to get the go ahead since it's not following the current remote protocol. Any questions, anything I missed? Feel free to ask. That's what I'm here for.
Thanks, Tasha. Any questions?
I think I would just say, Tasha, great job. Excited about Saratoga coming online as well. The important thing with any of the primary stroke centers, as we know, is rapid identification of LVOs. And for those agencies who are in, southern Saratoga County, if you don't have an LVO and it's not greater than 3 on that, on the FAST score, Saratoga may be a fantastic destination for that patient. And for the people in northern Saratoga County, it increases the opportunities. So I think this will be an important step for the region. So I think at this point, just about all of our hospitals are going to be on equal footing in order to be able to take care of acute strokes, which is great.
And thanks, Mike.
All right, thank you.
It's definitely been exciting. We put a lot of work into the program and really have a smooth process going on. Huge difference from when we started a year and a half ago to where we're at now.
Going to be doing the teleneuro, where is it going to?
It's a company called Telespecialists. They're actually nationwide.
Okay.
We have like 84 physicians. The last time I checked, it was somewhere around 84 neurologists on board to take a call at any time.
That's great.
And they've been fantastic to work with. They're really a great group. I don't know what the long-term plan is as far as if we'll keep Telespecialists or if eventually Albany Med may be our teleneuro provider, but as of right now, there's been no discussion of an immediate change, and we're very pleased with Telespecialists. And they do daily rounding, so if the patient is seen for an acute stroke or subacute stroke in the ED, then the telespecialists are going to see that patient every day during their hospital stay. It's really worked out well.
Tasha, do you have any neurology coverage in the hospital for other consultative reasons other than stroke?
Yes, they cover anything neuro except for pediatrics. And they
don't.
The telespecialists.
Okay.
Yep, the telespecialist will cover anything neuro. So say you bring somebody into the ED, a lot of the altered mental status end up going under a stroke alert, but altered mental status, seizures, anything that we need a helping hand trying to get a differential diagnosis on, they'll jump right on the line. They're usually on within 10 minutes. For a stroke alert, they're on usually within 2 to 5 minutes, honestly. Stat consults are usually on within 10 minutes, but they actually have an hour to get on. Routine consult, somebody that doesn't necessarily need to be seen while they're in the EAD will get seen the next day. And then we also have options to just call and say, we don't necessarily need a consult. We just need some advice on a patient that you've already seen. They're great. We just call them up and they're willing to chat with us, willing to teach. Fantastic group.
Thank you.
You're welcome.
Anything else for Tasha? Okay, thank you very much.
I thank you guys for giving me the opportunity to talk, and my email is in the invite. So if anybody has further questions, wants to talk offline, by all means, get a hold of me. I'm always available.
Okay. So next, to go back to the Remo consolidations. So far,
the chips are gone.
What's been going around is more of a for the Remos themselves to operationally merge. But I want to talk about if we want to go down the route of merging the Remacs as well. I think functionally it would be, especially if we can keep some virtual attendance, I don't think it'd be that big of a lift to do functionally. And I think if anything, it would just kind of increase the breadth of our experience and our discussions.
I think, Rob, to piggyback on that, we've certainly been talking about this for a long time, and I think it's an exciting opportunity, and something, quite frankly, that we really need to move towards. What we've certainly seen through the course of the last 2 years is at least a good proportion of the Arams region, as well as a good proportion of the Mountain Lakes region, do navigate towards the Capital District. And there's been a significant amount of leadership and discussion coming out of this area. I think bringing us all together on a regular basis will be, frankly, the best way for us all to continue to make sure that our systems are improving over this portion of northeastern New York. So I'd actually like to make a motion, which is that we form a small group with partners from Arams and Mountain Lakes, from their voting members, and that you, myself, and Tim, as well as 1 or 2 other people, if interested, investigate the concept of how we would merge the 3 Remacs, either in a stepwise fashion or just in one fell swoop, to make sure that all the constituents are appropriately represented.
Okay, Mike, was that worded as a motion?
Yes, sir.
Okay, do we have a second?
I'll second.
Okay, any discussion?
Yeah, just a little bit. Would there be one central person, or we need to decide on how we're going to do this? Is that what we're going to end up investigating, Mike? I assume
So out west, they actually merged Remax a whole long time ago. I think that this is something where a few of us sit down, come up with a basic plan, and then present it back to the 3 groups, and see what's going to be the best solution for all of us. We need to make sure that the constituents within the regions feel as though they're adequately represented, because clearly there are differences in what's available in terms of resources across the North Country and in many parts of Arams. Obviously, the medicine is the same. Personnel concerns are the same. But we need to make sure that everybody feels as though they have adequate representation. The other thing we need to do is to make sure that in having discussions and then operationalizing a merger of the Remacs, that we maintain the same influence and representation at the CMAC. So we would need some advice on that as well from Mr. Hannigan. But I think exploring how we can do this, if we look at this call, we have representation on this call right now from Mountain Lakes and Arams as well. There is significant interest in both to bring us all together so that we're having similar discussions. And quite frankly, the folks from up north and the folks from our west have a lot to add. And I'd like to make sure that we're all talking together.
sounds good.
Any other discussion? Okay, anyone opposed? Okay, so work on getting that little subcommittee together, so we'll hopefully have a report for the next meeting. Any other discussion or topics for today?
Rob, I'd bring up one item just as a little addendum to the previous discussion about the proposed budget for the state and so forth. Along with what Don had mentioned, some of you may be interested in the fact that what's also proposed, as I understand it, is to bring all healthcare licensing and oversight under the Department of Health. So currently, the Department of Education has a role in licensing healthcare professionals and also oversight of nursing practice, including nurse practitioners. And my understanding is that the proposal is to bring all of that under the Department of Health. So I don't know where that'll go, but I just wanted to mention it as an FYI for everyone.
I like it, interesting.
Sam, I think that actually is really interesting. In particular, it would be very fascinating to see what happens with the State Board of Nursing and their approach to the use of anesthetic agents at the direction of physicians and emergency departments, particularly when some of this stuff is more closely regulated than having people make decisions well beyond what their regulatory or legislative responsibilities are. So.
Exactly. There's a lot of, I could see a lot of potential opportunities as well as issues with this. So we'll just have to see how things evolve.
Thanks, Sam. Don, what'd you have?
No, we're moving to old business, Rob? Or are we still in the business here?
What do you have for old business? 'Cause I have a blank agenda for old business.
Okay, just old business. As you know, we were scheduled, myself and Mark Philippi from SEMSCO, to meet with the commissioner this month. That was delayed, and we'll be meeting with her on February 25th. Hopefully it will be in person. The previous meeting was going to be virtual, but we have hope that hopefully by that time she'll be willing to meet in person, and I'll keep you guys informed as to how that goes.
Okay. Any other discussion or?
What was the date you're meeting with her?
February 25th.
Okay, thanks.
So Rob, I had a couple of other things really quickly. First is hospital diversions. This is something where we're hoping to improve communication between the hospitals and the agencies and the public safety answering points. We continue to investigate some things. We have one potential answer through the med that I will bring more information to members of this group offline once we've finished our discussions there. Some of us also asked Tim to investigate whether or not I am responding would be a good, more granular way to get in touch with people. So we'll be doing that as well. In particular, that pertains to mental health diversions, which have been a huge issue. Rachel Handler from Samaritan has been extremely helpful in terms of getting people together for discussions. And those discussions and conversations offline continue involving people all the way out into the Arams area and up into Mountain Lakes. Another way that this footprint really is extended well beyond our 6 counties to see what we can do about taking care of the increased volume we're all seeing. So we'll keep people posted on that over time. I think what's important for all of us just to continue to pass on to our EMS providers is that we're aware of their concerns. We don't like this any more than they do. And it's awful for operations. So we'll just continue to try to move forward with it. On good news, though, the governor did sign into law the ability for air medical agencies to carry blood products. Those regulations have not yet been promulgated by the Department of Health, but they are in process. And LifeNet, at the very least, is moving forward with a program to be carrying blood on board their helicopters. Along with this, unfortunately, there has not been a movement at this point that I know of, unless Don knows something else, to make it any easier for ground ambulances to carry blood from one hospital to another. That still remains a rather difficult process. What's nice is the commercials are in a position where this can now be done, throughout our region. We need to continue to push that one forward to make it easier. And those are the big things I have for this group. Thanks, Rob.
Yep. Okay, any other discussion? Any topics for next month?
Well, just a question. I'm going to piggyback off of Mike's comment. Did Mohawk complete their signature agreements with everyone except for St. Peter's Health Partner for blood transfusion for their critical team? Did that get signed and done?
Mohawk is online with Ellis Hospital and Albany Med. Our application for all of the St. Peter's partner hospitals is currently sitting at Wadsworth. And I'm having some challenges getting an update on that application. I don't see any reason why that application should not proceed forward. It basically was a, remove one name, plug in the next name, and resubmit the same application that's been successful for the other 2 facilities that we are online with. But at this point, we are still working, trying to get a status update or a letter of acceptance back from Wadsworth regarding the St. Peter hospitals.
Do we have a Department of Health representative on this call right now? All right, seeing none, I will make a follow-up call to Ryan on your behalf, Dan, and see whether or not we can get any movement on that, because that's got to stop.
I'm wondering if Dr. Olkowska, who was our point person that was reviewing and approving the applications, either changed position at Wadsworth or is no longer there, because I sent a status update request earlier in January. That email went through, but I didn't get a response. It was shortly after the holidays, and I was willing to wait a couple of weeks. I recently resent that, and my emails are being rejected by their server. So I don't know if there may have been, a point person change there. I put in a help request email to Wadsworth to be redirected to somebody. That was yesterday after my second failed attempt to get to Dr. Wadsworth, Dr. Acosta. And I haven't gotten a response back. I'll be perfectly happy to wait a day or so to see if I get a response and then go to Ryan myself. I don't have a problem with that. I was going to try to get them to work out their, get redirected there if at all possible first.
So Dan, this is something that I am more than happy to bring up as a seated member of the STAC next week at the STAC meeting. Don can also bring that up at that same meeting. This is bureaucratic roadblocks to what should be simple medicine. I don't have to tell you that that's just silly. Let's just get this done. Call them today. Let us know what's going on. We'll bring it up on the open meeting at the STAC if necessary.
I think STAC is postponed, Mike. I think they just sent in an email.
Yeah, it's postponed, Mike, until March or April.
Well, then I guess we won't bring it up next week.
Hopefully it's resolved by then.
Yeah, I can't wait that long.
If I don't get a response fairly quickly from Wadsworth, I certainly can address this issue with Ryan and see if I can't get, his assistance in getting this matter ironed out.
I think Dan, I think you should bring it to Ryan. I also think that either Don or I should bring it to Greg Young, and let's just elevate this to where it needs to be. This just has to stop. You've completed the paperwork. You've contributed the pound of flesh that they require you to in order to do the exact same damn thing. It makes no sense that patients at St. Peter's shouldn't be able to get the exact same interfacility care that they can if they're traveling from the city of Schenectady. That does not make any sense whatsoever. Let's fix it.
Just a comment, if I could. When we tried to renew our CLIA, and that goes through Wadsworth Lab, it looked like we were not going to get our license by the time our current one expired, and then we were sending emails and phone calls, et cetera, and nobody answered either emails or, and Dr. Doyna's aware of this. They weren't answering any emails or answering any phones. So I'm wondering if there's a staffing shortage, if they got a COVID issue, or if there's some kind of crisis going on there. Just an FYI.
Yeah, I can tell you guys, if you call their phone number, they basically say they're not there. They're all working from home and to address your concern through an email. So that's the avenue I went, but I haven't gotten a response back. But I did, to their defense, I've only sent the email out to the help group. yesterday. So
So Dan, if you don't get a response within a few days, let Mike or myself know.
I will.
We'll escalate it up the ladder there.
Okay. Any other discussion or topics? Okay, so our next meeting will be in April. So look forward to seeing everybody then. And we'll see if that's going to be an in-person or virtual. If it is a virtual, if it is in person, we'll make sure we have a strong virtual component for it, for those who can't make it. Okay, can I get a motion to adjourn?
I'll make the motion.
I'll
Okay.
second.
Thank you very much.
Take care, everybody.
Hold on.
Thank you all.
Yep.